I'm doing well. How are you? Good. All right. Make sure you're all appropriately socially distanced. So, Shelley, just want you to notice when you come up here, we got the hand sanitizer from the University of Nebraska. So, and you brought your own. Good. So, again, thank you everybody for joining us here today to talk about what the state is doing to slow the spread of coronavirus in Nebraska. So we are now at May 1st. Happy May Day, everybody. And we've gone beyond the 21 days that we talked about 3 weeks ago with regard to the month of April. However, we are still following our rules of social distancing. As I have mentioned, we are still going to be at the 10-person rule through the month of May. And we are still following our, we don't have our rules up here, but we're still following our 6 rules with regard to, again, when you're at home, don't take any necessary trips outside the home. When you're at work, make sure you continue to social distance or work from home if you can. 3, we want you to shop once a week. Go alone. Don't take the whole family. Make it efficient. Have a list. Go to the store. Get out. 4, help kids socially distance. Play at home. Avoid group sports and playgrounds. 5, help seniors socially distance. Maybe you can run errands for them. Go shopping for them. Help them stay at home so they don't have to go out and they can avoid those crowds. But do not go visit them in a long-term care facility. And then finally, we want you to exercise daily at home or with an appropriate socially distanced exercise. So those are our 6 rules to keep Nebraska healthy. We are still going to be practicing social distancing for the foreseeable future. We want still people to follow those rules. So please remember those. Second, testnebraska.com. We've got over 110,000 people tested, so we're very excited about that. You can sign up at testnebraska.com. If you want to get the Spanish language version, that's testnebraska.com/ES. And then you can fill out that assessment. It takes less than 5 minutes. It'll go into a secure database. That database will not be sold or either in aggregate or individually to anybody else. It'll only be for states, the state's information. And this is how we're going to schedule people. So when you take the assessment, it'll go into that database, and then we'll reach out to you via email to get you scheduled to come in. And in fact, we're going to start doing that on Monday. We're going to be in Omaha at the CHI Health Arena from 1 to 6. Now, it's important to know you just can't show up there and get tested. So don't just show up there unless you get that email. Those emails start going out this afternoon. So if you signed up already for testnebraska.com, you may be receiving an email that will then allow you to schedule for a 30-minute period sometime Monday afternoon if you're in Omaha. So, but you will only be able to go get that test if you signed up and if you receive that email to get scheduled. We're also going to be doing it in Grand Island. We'll be in Grand Island at the State Fairgrounds from 8 to 6, but the same rules apply. You just can't show up. You have to have that email that you got, that you were selected to get the test, and then you'll be given a 30-minute block of time to be able to show up and get that test. What will happen is you'll get swabbed, we'll take the sample, we'll process it in our lab, and then we'll send you an email with the results. We're shooting for about a 48-hour turnaround time on that entire process. We also had the question asked about if you want to update your status. When you get that email, you will be allowed to update your status. If you want to go in and update your status before receiving an email to get scheduled, you can still do that. Just use the same email address. So if you go on, this is one of the questions we got yesterday. So if you go on, you got that email address, and you refill out the assessment, the survey, and use that same email address, the system will automatically re-update your data. It'll connect it up to that email address, and so you'll be updated within their system. So, for example, if you have different symptoms or something like that, you can update to be able to do that. And again, our priority is going to be healthcare responders and first responders, or healthcare workers and first responders, and then highly symptomatic people, less symptomatic people, and then as we have capacity, asymptomatic people. So that's kind of the order that we're going to do Test Nebraska. So again, we want people to sign up. Please go out there, take the challenge, hashtag Test Nebraska Challenge. Be a great way to get 5 of your friends to sign up as well. That's how we're going to distribute these testing resources, is based upon people filling out that survey, taking a look at that. So the more people in your survey fill it out, the more likely you are to have testing in your community. So again, we're going to start that testing, start taking it on Monday, kind of as a soft launch, rolling out slowly, but then we'll be continuing to expand that capacity for testnebraska.com till we get up to about 3,000 tests a day on top of the 1,000 to 1,500 tests a day that we're running right now. And we're looking for other ways to expand that testing too, so that's not the only thing we're doing, but testnebraska.com is a way for everybody to participate in this fight against the coronavirus by signing up for testnebraska.com. So please sign up. Okay, so May is traditionally Beef Month here in Nebraska. So I will be signing a proclamation making it Beef Month once again here in the state of Nebraska. Now, beef is the single biggest industry that we have in the state of Nebraska. Generally accounts for over $6 billion in sales here in our state. And we have a long history and tradition in our state of raising beef. Men and women for generations have worked hard to be able to have the best genetics for our beef. We've got a great environment for our beef. Think of places like the Sandhills. And of course, our farm and ranch families that take care of our cattle. And really, one of the things I always like to stress when we're talking about Beef Month is that our cattle producers were the original conservationists. They wanted to make sure they could pass that generation on down, or pass that ranch down to the next generation. And that's been going on for generations here in our state. And that's why we produce the highest quality beef in the world right here in Nebraska. And you don't have to just take my word for it. You can take the word from all of our customers around the world. In fact, over the last 10 years, our beef exports are up 96%. We are the #1 beef supplier to the European Union and China. We're #2 to Japan, Hong Kong, Vietnam. South Korea is also another big market for us. So we have greatly expanded our exports around the world because of the high-quality beef we have here in Nebraska. In the past, when we've had high tariffs in Japan, even with those high tariffs, we've been able to grow our market share because our consumers recognize the high-quality beef that we have here in the state of Nebraska. So it's always a privilege for me to recognize the men and women who work so hard to produce the beef here in our state. So I'm really excited to be able to sign this proclamation declaring it that May is Beef Month here in Nebraska and urging all citizens to take due note. So with my signature, we are officially proclaimed Beef Month here in Nebraska. And to talk today about beef and the industry, we've got Steve Wellman, who's our Director for Agriculture. I'm going to call him up here in a minute. We also have Buck Wehrbein, who is the chair of the Beef Council here in Nebraska, and also the national chair of all the Beef Council states, right, around the country. So the Federation, the Beef Council Federation. So he is going to come up and say a few words as well. And then we'll, so Steve, you'll introduce Buck, and then Buck, you'll give it back to me. And then I'll introduce Shelley Sweethelm, who is the lead nurse for the biocontainment unit and the emergency manager for Nebraska Medicine. And she's going to talk about some of her tours of the meat processing facilities we have here in the state, and also the Global Health Center's meat processors COVID-19 playbook that the UNMC has been working on to be able to establish the best practices for these facilities as well. And in fact, I think that the CDC recently came out with some guidelines, but ours are better. So I'm going to brag about Shelley and her team's work there. So with that, though, Steve, I'm going to go ahead and call you up to talk a little bit about May is Beef Month.
Well, thank you, Governor, and thank you for proclaiming May as Beef Month. Nebraska is known as the beef state. We're known here for the product within our state, but we're known around the world, as the governor mentioned, for the wonderful, safe, and high-quality beef products that we produce here. And by we, I'm talking about our farmers and ranchers. That's where it all begins. Nebraska is so well suited with our sandhills, grasslands, and our dedicated resources of our humans, our farmers and ranchers, but also the water that we're blessed with and our other natural resources. And what I really want to talk about is, Governor Ricketts talks and mentions a lot about process improvement, continuous improvement. Well, Governor, I have a continuous improvement story for you today, and it's the beef producers in Nebraska. If we compare ourselves from now back to 1970, we produce the same amount of beef today as we produced in 1970, but with 1/3 less animals. And nationwide, we produce about 18% of the world's beef on 8% of the animals. So it's a great message and how productive Nebraska and U.S. cattle producers have been and how we've continued to improve since the 1970s, and we're still continuing to build on that yet today. And those improvements come from the long history that we have, the experience that our growers and ranchers have, but also the improved genetics, the investment they've made in their operations and their seed stock, the way they manage the grassland. And cattle can turn low-quality sandhills grass into the most nutritious product, the food product that we can have. So it's a great way to utilize resources, control the resources, stop invasive species, that types of things, and really conserve our resources and move that forward into a nutritious product. So with that, Buck, you're a great spokesman for the beef industry, and I welcome you to the podium. Thank you.
Thank you, Director, and thank you, Governor. Always appreciate being invited to this. It's a big day for me and big day for the beef industry with proclaiming May as Beef Month. A year ago, my colleague, Mike Drennan, who was president of the Nebraska Cattlemen, stood up here and talked about the hardships and the challenges with the floods. This year, we're up here and we've got challenges with the COVID. And so that's a pretty big 1-2 punch. And so our whole ag sector, because of these things, is suffering, and cattle producers are too. And that's the bad news. And the good news is the light that we see at the end of the tunnel, we believe now, is not another train. We think that we are going to come out of this. And talking about the 1-2 punch, if you've ever been in a scrap, you come out of that with a black eye maybe and a fat lip, but you do come out of it. And we will come out of this. And we want our consumers, our customers, to know that the beef that they get is the same high-quality, tasty, and nutritious beef that we have always produced. And so on behalf of all of our producers here in Nebraska, we are working every day to provide that. Our consumers, our customers want our product, our high-quality product. Our producers need the processors to be able to process it to get it to those customers, and the transportation and so forth. And so I want everybody to understand that everybody in this process is working feverishly to get things back online. So very happy to be here, very grateful to all of you to be here. The checkoff that I represent has worked for years, decades actually, developing information, recipes, information on cuts of beef that's available at nebraskabeef.org and also beefitswhatsfordinner.org. So people are eating more at home, they're cooking more meals at home for more people, and there is a great resource on cuts of beef and how to prepare it and ideas for meals. So we are reaching out to our customers. We want them to know that the quality is still there and will still be there. And with that, I thank you, and we will come out of this, and beef, it's what's for dinner. Thank you.
Thank you, Buck. Hey, Buck, you can take this with you as well. Now, what's your favorite cut?
My favorite cut? I'm a New York strip guy. Yeah. Yep.
I'm a ribeye guy myself.
Yeah.
Bone in.
Well, it's kind of, you know.
Yeah, both great cuts. All right, great. Well, thank you very much, Buck, for being here. So one of the things that we've been talking a lot about is our whole meat processing facility or the facilities and the whole food supply chain, and how important those meat processing plants are to the food supply chain. And we've been working very hard here at the state of Nebraska to be able to help protect the health and safety of the workers, as well as keep those facilities in operation, because they are what feed our state and our nation. And so as part of that overall plan, we've been having weekly phone calls with our meat processors, and we've also been leveraging the expertise of people like Shelley Sweethome to be able to go visit these facilities, give them feedback on how they can do a better job of doing that social distancing in what is admittedly a very difficult environment to do social distancing. So, and as part of that, doing that research, doing those visits, and then an exhaustive literature search and best practice search and so forth, the Global Health Center at the University of Nebraska Medical Center has produced this meat processors COVID-19 playbook that is not only being distributed here in the state of Nebraska, as I said, CDC came out with guidelines, but I think ours are probably even a little bit more extensive about some of the things they talk about. And Shelley, I'll brag for you because I think that's true. And, but also that this is being distributed in other states. It's available online, so anybody can use it. And again, it's just part of the overall effort the state is putting into keeping people safe and keeping these facilities in operation. And with that, Shelley, would you come up and please talk a little bit about what you found?
Great, thank you, Governor. Well, you might wonder, what does a nurse know about meat packing plants? So I grew up on a dairy farm, and I currently live on a beef farm. So back in my nursing school days, I learned a lot about infection prevention and control, and that is totally applicable to everything that we're experiencing right now. So as the governor said, we do have a new playbook that's out. It's built on a risk mitigation framework, the hierarchy of controls. So the Global Center for Health Security has that on their website if anybody's interested in looking at it. And this has very much been in partnership with the Center for Agriculture, Safety, and Health at the College of Public Health on the UNMC campus. We know that a lot of work has gone in to the meatpacking plants and improving many of the things that we would suggest as best practices. But there's always this effort that needs to also happen in communities. So we're very much working on both of those aspects. So some of the things that we found are truly best practices. So many mitigation strategies, whether that's putting in physical barriers, changing their airflows, working through social distancing, putting X's on tables, making sure that breaks and lunches are scattered and spread out. Coming to work, they're doing screening and definitely providing some masking now to their workforce. So those are really important things that we've seen as best practices. There's always opportunity for improvement, so I think the advice would be that we need to also just really hardwire many of these practices that we've suggested. And so I think if there were an opportunity, that's what I would say it would be. So thank you for the opportunity, and this has been a true team effort from the Global Center for Health Security. Oh, number 11 was this morning. And then we've done a couple of virtual ones too. So we've got more planned for next week and probably a few more after that.
Great, thank you very much, Shelley. And Shelley is also part of our overall unified command team working on facilities in general. Meat processing is one of the ones she's been working on, but she's also been involved with those long-term care facilities as well. Also, as part of our program to be able to make sure that we're reaching out to other communities, we have produced a couple of videos to be able to help families to be able to either follow 10 rules to be able to stay safe and stay healthy during this pandemic, or the second video is about what do you do if your family members have been exposed or have coronavirus. And those, you can find those videos right now on my YouTube channel. Did you guys know I had a YouTube channel? Guess what? I got a YouTube channel. Go to YouTube, search Governor Pete Ricketts. And right now those the videos are up there in English, Spanish, French, Nepalese, and Taylor, what's the fifth one we got? And Somali. And then we're planning, Arabic and Nepalese, and we're planning on picking up. Somali's on there now. And we're going to pick up Karen and Arabic coming down the road, right? Hopefully even maybe by the end of the day. So a variety of languages out there to be able to reach out to communities where English may not be your first language, but to get those out there. So if you want to check those out, they're on my YouTube channel. Just go to YouTube, search Governor Pete Ricketts, and you can find them again in those English, French, Spanish, Somali, Nepalese, and then coming in Arabic and Karen. So go check those out. And any organization wants to use those, please feel free to steal those liberally. We want them distributed, so if you think your organization can use those, please take those videos, send them out, get people to link to whatever communities you think may be able to benefit from those videos. We really want people to use those. So thank you very much, and I want to thank Impact Nebraska, because they were the people who, Impact Nebraska helped create those videos, so thank you very much to Impact Nebraska and my lovely wife, Suzanne, our First Lady, Suzanne Shore. Also, along those lines of, we want to talk about our hunger campaign here at the state of Nebraska. We do a campaign to fight hunger with our state teammates. It's our 35th year of doing that. It supports the heartland of the Heartland Food Bank and the Food Bank of Lincoln. That allows us to reach every food bank in the state. There's an opportunity for our teammates to be able to support their local food bank. And again, especially at this time when we're going through a pandemic, as we've already had some of the food banks up here talking about the need, our state teammates are stepping up to be able to help meet that need. So I'm very proud of all of our state teammates. And again, this is our 35th year of doing that. So thank you to all our teammates. And then also, I just want to reference here the directed health measures. We have new directed health measures that will begin on Monday. So for the counties that we've got here in, let's see, we've got Douglas, all these blue ones here, and these blue ones here. These are kind of those 56 counties that will start May 4th. And that is with regard to the relaxed directed health measures that we have, with regard to restaurants being able to operate at 50% capacity, salons, tattoo parlors, massage therapy being able to operate under the 10-person rule, and again, all of these with restrictions. Also, the beginning of elective surgeries, May 4th, and then houses of worship will be able to, again, be operating in a socially distanced way, but not necessarily limited to the 10-person rule. It will be something that they will be, still have restrictions, but again, doing good social distancing. So in those kind of like darker blue, that's the counties that will be allowed to start doing that May 4th. And then if you look at the lighter blue ones, those are the ones that will start May 11th. Again, Shannon, here, see, we got Lincoln County, May 11th. Sorry about the mistake a couple days ago. So got it right there. And then with the green ones, you may notice we have not made an announcement about those yet. You may also notice that those are the ones where we have some of those communities. The green ones there are the communities that we have that have some of those food processing plants in there. So we're still working with those local public health departments about what the next step for them is going to be going forward. But they will not be under the loosening restrictions that happen either May 4th or May 11th. So that is the program for that, the map there that I wanted to call attention to. And then also just a reminder that we will continue to have briefings in English at 2 p.m. Central Time next week, with the exception of Monday, because of my radio call-in show, we will be doing that at 1 o'clock instead of 2 o'clock. And then we'll have Spanish briefings at 5 o'clock next week, Central Time, Tuesday and Thursday. So again, English briefings, 2 o'clock, with the exception of Monday at 1 o'clock. Spanish briefings, 5 p.m., Tuesday and Thursday. And then also I'll be on NET on the Dennis Kellogg's Speaking of Nebraska at 8:30 next week, Thursday night. So with that, I'm going to go ahead and get into some of the questions that we have received. Patrick Johnstone, KNOP, with a lot of schooling and work being done from home, have there been discussions or plans to expand internet access for rural areas that may not have access to strong internet? And actually, the Public Service Commission actually has a program for low-income families, so you can check that out on their website to be able to get that internet service subsidized. So if you're one of those families that is looking to be able to add internet access because of the pandemic and kids staying from home, please go check out the Public Service Commission's website. Matt Wiesner, NTV. Total COVID cases in long-term care facilities, nursing home facilities in Nebraska to date, and total deaths. So we've had 242 total cases and 48 deaths in long-term care facilities out of about 52 total nursing homes that have been impacted by that. And I know that many of those have been in hospice care. So we do release that number for the media if you have an interest. Again, we will do it based on an aggregate of all long-term care facilities, but we are not going to break that out by individual facilities. But total deaths in long-term care facilities, 48 for the state. And to put that in perspective, that's out of, as of 6 o'clock last night, it was about 70 total fatalities in our state. Tara Campbell, WOWT. Are there plans to extend the executive order halting eviction hearings for tenants impacted by COVID-19 past May 31st? We will certainly take a look at that with regard to where we are with regard to the emergency as we get closer to that date of May 31st. What protections for tenants will there be in place to prevent mass evictions once the order runs out? So again, the reminder for how we structure this executive order is that we waive the statute that requires this to be processed in 14 days. But every one of these evictions will still have to go through the court process, so there's not like a mass eviction. Every one of these cases will have to be adjudicated independently at the rate that the courts are going to do that. Are public health concerns about where tenants will go if they are evicted? Homeless shelters are already full. So again, I want to remind people that the evictions that we have waived that requirement on are the ones that are impacted specifically about coronavirus. And that to that, we are working, as we mentioned yesterday in our press briefing, very diligently on getting those payments out with regard to the unemployment benefits, the pandemic unemployment insurance coverage that is, we're working to get through as well. That just started processing earlier this week. So that is going out the door, plus the $600 from the federal government as part of the overall emergency response. So people should start getting those. So my point of getting into all that is that we expect that a lot of people will be able to have the funds available to be able to make their rent. So certainly we want to make sure that tenants have that possibility. And just as a reminder, the executive order does not cover people who are engaged in criminal activity or who have been vandalizing the apartments or anything like that. So just keep that in mind, that it's not everybody, because there are legitimate public health concerns about people who are doing criminal activity in apartment buildings or damaging the facilities. Elise Balin from the Scottsbluff Star-Herald. Could the state of Nebraska do like Wyoming's Food Freedom Act and lift restrictions on beef and pork from needing FDA inspections to allow meat to be directly sold to consumers? We kind of talked to this about the other day, and Steve, I'm sorry, I was going to ask you about this beforehand, so, you know, I surprised John yesterday, so I'll surprise you. So how can Wyoming waive the USDA's requirement for inspections? Do you know what that food freedom?
They have their own state inspections, and they have some different legislation for Food Act.
So Wyoming has different legislation, and they have their own inspectors with regard to that. So they had the ability to waive those inspections, whereas we use the USDA inspectors, and that would require USDA waiving of those inspections. Is that accurate?
I'm not sure they're waiving the inspections though either.
You don't think they're waiving the inspections either, though? Okay.
They have law in place that allows them to utilize their state inspectors.
So they have laws that allow, a law in place that allow them to use their state inspectors to be able to accomplish the inspections so that that meat can be sold to it. We don't have that law in the books, so we cannot do that here in the state of Nebraska. Did I get that right? Okay, Elise, you got your answer right there. Steve says yes. So again, Wyoming's got different laws. We don't have those laws in place to be able to use our state inspectors, but those meat lockers are still being inspected in Wyoming just by state inspectors. They have to be done by USDA. And just so you know, folks, we have looked into this as well. I think we covered this in the last couple of days. Even if we could get that waiver of inspection, my understanding is that most of these meat lockers are operating at overcapacity right now anyway. So I'm not sure that it actually would benefit much, because they're already working as hard as they can with the current business they have. I don't think we'll be able to get any additional processing out of them. What is the state of Nebraska doing to help producers get through struggles of meatpacking plant closures and issues with meatpacking plants, employees not returning to work? And again, one of the things we're doing here at the state of Nebraska is we've reached out to USDA, Secretary Sonny Perdue, to be able to talk to him about this. One of the things that they have done is they've started a program, a $19 billion program. $16 billion of that will be paid out to producers across the country, and then $3 billion of it will be used to purchase things like dairy, fresh produce, and stuff and things like that for food banks. So USDA has an overall $19 billion to help out producers in our country. Admittedly, though, $19 billion, while it's a lot of money, gets spread out over the entire country, that it's just going to be a step. Another thing that we have been working with and encouraging the USDA to do, and I know Sonny Perdue has got an investigation going on specifically with regard to pricing. Box beef is fetching a much higher price than what our producers are getting for their cattle, so that's one of the issues that USDA, and that's been an ongoing issue, by the way. That's not just a pandemic issue. And so that's one of the things USDA is investigating with regard to, how to get some relief to our producers. And the question was, even if a temporary change in a state policy could help meat producers get through this time of hardship, why is not a step being taken? So I think, again, we're looking at a variety of things to be able to do to help that. Steve, is there anything you want to come up here and say with regard to that question?
Yeah, we've looked into this quite a bit over the last month on what we can do and how we can be helpful in Nebraska to actually get products from the farm through the custom exempt lockers and our local lockers and processors. Again, as was mentioned, It is a USDA inspection rule. Nebraska statutes, we do not have state inspections, so we rely on USDA. So it would take a change of the law. And currently, I mean, we've reached out to across the state and to these local processing facilities, and they are maxed out. I mean, they're busy. Good for them at this point that they have this business, but I think they're pretty much tapped out on what they can actually accomplish. But we continue to look at that and see what else we can do to help get animals from, market-ready animals from the farms into the consumer's hands. So we'll continue to work on that.
Great, thank you, Steve. Okay, yeah.
The shortest, the quickest I've heard that you can.
Do you want to come up here? Why don't you come up here, Buck?
Well, you can just repeat.
Okay.
The quickest you can get in is like 5 months.
So Buck is saying the quickest you can get into one of these meat lockers is going to be 5 months. So again, not something that's probably going to be able to be of benefit in the short term for our producers. Thank you, Buck. All right, with that, we can go ahead and open up to questions and answers for the folks that are in the room.
Governor, the Sioux City Journal, citing an anonymous source that they say is familiar with the situation, says that 669 Tyson plant workers in Dakota City have tested positive. Do you have any information that would support or refute that?
So what Fred's saying is an anonymous source has said there are 669 people at the Tyson plant in Dakota City that have tested positive. We, the state, don't break out those numbers, and I haven't seen any numbers along those lines with regard to that. So I can't tell you how accurate that is or not. Other questions?
Some questions that have been submitted.
Oh, yeah, go ahead.
Andrew Zaki says the Nebraska Cattlemen called for the U.S. Department of Justice to investigate the price difference producers are getting paid for cattle and the price meat packers are charging wholesalers and grocery stores. How much has this issue been placed on the back burner, and does it need to be addressed?
And so Andrew Sake is just following up that U.S. cattle producers have called the Department of Justice to be able to do an investigation. And how much of this has been placed on the back burner? In fact, I don't think it's been placed on the back burner at all. I think it's just the opposite. I think with the pandemic, this issue has only gotten more attention. And Steve, I mean, Buck, what do you think?
There's an ongoing investigation after the plant fire in Holcomb, Kansas, and now this has been added into.
Yeah,
the,
so this.
I think the Department of Justice actually has been called in.
Yeah, so there was that plant fire down in Holcomb, Kansas, that really kind of kicked off this investigation. And Buck believes the Department of Justice has been called in as part of the investigation.
Bill Shammer from 1011 wants to know if the state will share the unupdated total number of people statewide in hospitals, in ICU beds, and on ventilators.
So will the state share statewide data with regard to the number of people who are in hospitals, on ventilators, and in ICU beds? Is that the question? Yes, absolutely, we can do that. That can be, we already put out there the percent on those hospital beds being used and so forth, but we can make that available as part of our, we can either do it one-off, Bill, or we can put it as part of our playbook or something like that. So yeah, absolutely, we can share that aggregate data.
Aaron Duffy from the World Herald says that you said the meatpacking outbreaks may be attributable to community issues or workers shopping and catching the virus at the grocery store. Doesn't the fact that UNMC has had to develop a coronavirus playbook for plant operations suggest that plants or the close quarters work inside from them are fueling infections more so than community issues?
So the question was, I said that this is a community issue with regard to the infections and the spread of the virus in our communities with food processors. Doesn't the fact that UNMC is actually working with the food processors say that this is a food processor issue? And actually, again, it gets back to this is a community issue, so it's not just a food processor issue. We can have direct impact on working with the food processors to be able to take those good social distancing guidelines and the work that Shelley's doing around best practices and so forth. And then we also need to work on the community side too. So again, getting to folks, helping them with the social distancing, especially in communities where English is not the first language, so that we get that message out there with regard to social distancing, that we get cooperation when we're doing testing and tracing of contacts and that sort of thing. So it is a unified picture here, just focusing on one aspect of it, whether you're just focusing on the work aspect or the home aspect, either one individually is not going to be sufficient. If I led Aaron to think a different way, I apologize for the confusion on that. What I'm trying to get at is you have to look at this in its whole and not just focus on one or the other.
She also asked how many counties will have extended DHMs and until when. Are the details of those DHMs still being worked out with the local health departments, or is it just an extension of the restrictions already in place?
So again, we just kind of covered this with regard, Aaron's asking about the DHMs and the, which counties are doing what. So Aaron, if you can look at your TV here, we got it right here. So 56 counties are going to be May 4th. These ones in light blue are going to be the ones that are going to be in, they're going to be coming up here May 11th. And then the green counties, again, this is the ones we're still working with regard to that DHM. So again, these are the counties that are being more heavily impacted. So you can expect that those are probably going to get pushed off to a later date, but we're still working with the public health department officials on that.
Andrew Izaki has a few questions about state facilities. What do we know about possible residents for the veteran home in Kearney who tested positive for COVID?
So actually, I just got briefed on this today. The question from Andrew Rizaki was, what do we know about residents at the Central Nebraska Veterans Home who've tested positive? My understanding is that we had 4 people test positive. They've all recovered, and that we actually had, had special designations where we were, concerned about where people were testing positive, but all those restrictions have been lifted. So that's a ballpark answer. So maybe what we can do, Taylor, is just follow up John Hilbert directly and have him talk to Andrew or give him a statement or something like that. But my understanding is, based upon our conversation today, that all those residents have recovered.
Are there any updates on cases in other 24-hour facilities that you're aware of?
Are there updates on cases in other 24-hour facilities that I'm aware of? I don't have any updates, but Shelley, I will ask you if you have any updates of 24-hour facilities that you know of?
No, I mean, just other than healthcare and long-term care.
Yeah, just long-term care, we continue to manage it. Dr. Antone?
I have the hospital data for hospitals, the high-volume hospitals, like in Grand Island.
I think he's looking more at the 24-hour facilities, though, where we're caring people, like, things like the Lincoln Regional Center and things like that, or, okay, nothing new, nope, nothing new there.
And he also wants to know, that this, with the state hasn't tested any inmates for COVID, are we going to allocate tests for them?
So again, with regard, Andrew's asking about inmates, and so again, the inmates will be treated like everybody else. We have a law in Nebraska, they've got to receive that community standard of care. So again, it would be the same procedure, whether you're an inmate or if you're in another facility. If somebody gets tested positive, we do the contact tracing, we reach out, all that sort of thing. So that's again, how our inmates going to be treated.
And then we have a question from Alexander Stone, from a viewer. As people are asked to go back to their offices, what guidelines should they follow? Should they wear a mask or keep desks 6 feet apart? Do we have other recommendations for that?
So Alexander Stone is asking if people are starting to go back into the workplace, what sort of guidelines should they follow? Should they wear a mask? They should keep 6 foot of distance? The answer is yes. So all those things are really good ideas. So when we're talking about our rules, which we don't have up here right now, but when we talk about our rules, those are all still good things to practice. When you're carpooling, don't carpool with anybody outside your household. Generally, that'd be a better idea. If you are carpooling with other people, only one person in the front with the mask, one person in the back with a mask. That would be a best practice when it comes to carpooling. Don't share your lunch, bring your own lunch, don't share utensils. Wipe down surfaces frequently, especially high-touch ones. Wearing the mask, 6 foot distance, avoid groups of more than 10 people. These are all the sorts of things that as you are in the workplace that will allow you to have those rules around social distancing. Is that it?
That's all I got.
Okay, yeah. No, go ahead.
Quite a few protesters out front today, obviously. They're happy the state is reopening, but maybe want a more aggressive approach. Any comment for them?
So the question was, we actually had protesters here at the Capitol today. Thankful that we're starting to open up the state, but want a more aggressive approach with regard to opening the state. And again, what we're going to do is we're going to take this a step at a time. Again, we'll take a step back here as well. The whole goal is to make sure we don't overwhelm the healthcare system. That's what our goal was 2 months ago when we set out on this, was to make sure that everybody who needs that hospital bed, ICU bed, or ventilator can get access to it here in Nebraska. And that's why we put these restrictions in place. And they've been successful. They've worked. Nebraskans have been extremely patient. They've worked with us. They've sacrificed. And we've been successful everywhere. Even in our hot stones, places like Hall County, we've been able to manage it in a way that everybody's received that care. And now, as we start loosening restrictions, we're going to continue to keep an eye on the healthcare system. So we're going to take this a step at a time, start loosening restrictions gradually, make sure we can keep the healthcare system stable, right? Preserve that healthcare system so that everybody can get that care. And then we will start loosening these restrictions as we see that we're able to do that. So we're gonna, again, take a methodical approach about it. I know everybody's tired of doing this, but we gotta do this in a way to make sure that we can still preserve our healthcare system. Yeah.
I have a question for Shelley, if she would.
Shelley, you are up. I told you you might get questions.
I was just wondering sort of.
No, come on up here, you're gonna have to, they're gonna be able to hear you. And so when, repeat the question so that they can hear it in the microphone.
I just want to know sort of what the implementation process will look like, or if you're aiming to get every facility in the state to sort of have this, or what the approach looks like when you're talking to these facilities.
Yeah, so far, we've been able to
Repeat the
achieve.
question.
Oh, the question was, what is our approach with all of these meatpacking plant facilities, and how will we go about that? So for right now, it's working well that they reach out to us and request a visit. So a lot of times that comes from our public health partners. So then they make contact with the plant, or we've even started to get some questions from processing locations that aren't necessarily doing the whole cycle. So we've shared our tool broadly, and they do a self-assessment. I actually got a self-assessment back from a plant today. And then we do a phone call. So it's just really up to them what process works well. So, does that help?
But it is a goal to try and get everybody using these best practices.
Yes, absolutely.
And then the second part is, as we continue sort of on in this, is there, I know you published this one here, is there any chance that you would add to it or make adjustments as need be?
Yes. So the question was, is there going to be any additional guidance that we provide or any updates? Only daily is what I will say. So you will always find the most up-to-date copy out on the Global Center for Health Security website. Okay, thank you.
Great, thank you, Shelley. And Shelley has been putting on a lot of miles on the car, getting around to these facilities. So thank you very much, Shelley, for all your hard work and the hard work of your team to be able to make these visits.
Governor, is it within your power to make these best practices mandatory, and, or is it entirely up to the companies?
So the question was, is it within my power to make these mandatory? Again, what we're really, the approach we're taking is these are non-regulatory. So this is about cooperation. And really, this is the same approach we've taken with regard to this entire health emergency. Really taking an approach of communicating, getting people's collaboration to be able to get that effort that we need to have this to be able to work. With regard to inspections and things like that, that's actually OSHA. So the actual regulatory side of this is actually a federal government responsibility. Go ahead, Fred.
Okay. I have heard, and I haven't confirmed this, that residents that are positive for COVID-19 in Hall County are being kept in their long-term care facilities and not transferred to the hospital. Is that true, and is that desirable?
So Fred has said that he's heard that in Hall County that residents in long-term care facilities are not being transferred to the hospital, they're being kept in their facility. Let me take a step back. Our policy with regard to long-term care facilities is that if somebody tests COVID positive, coronavirus positive, as a resident, that they are isolated within the facility if that's possible. And if they need acute care, then they go to the hospital. And so once they no longer need acute care, then we transfer them back out of the hospital and preferably back to the residence where they came from, if it's possible, if they can be done safely. Now, if that can't be done safely, we find other accommodations for them. So, for example, take the Blair House or the Carter House in Blair. In that case, it was actually had to do with the workers. Enough workers had tested positive that we were worried about being able to provide that 24-hour care. So then all the residents were moved out to other facilities that we had previously arranged to make sure they could be cared for until the facility would be clean. The workers, we could reestablish the workforce and that sort of thing, and then the residents were moved back. So it really is a case-by-case basis with regard to the facility and what they're actually able to handle, and it's a variety of things with regard to their layout, how they can isolate people, workforce, the status of the workforce, that sort of thing.
So it's not the case that people are being kept in.
So Hall County was not an exception that we're asking people to isolate within their facility if it's possible. Other questions? Friday afternoon, everybody wants to go home? I'm cool with that, just so you know.
Question.
Oh, Taylor.
Kristen Whitman at KPTO. Can COVID be carried in beef or poultry?
So the question from Crispin Whitman at
KPTM.
KPTM asks, can coronavirus be carried in beef or poultry? And the answer is no. It's a respiratory virus. It gets spread. This is why masks work really well, right? Because they're spread through the droplets that you may exhale or cough out. And so that's why we ask people to wear masks. But it cannot be, it's not a bloodborne transmission. It can't be borne by mosquitoes. It's not transferred through beef or poultry or anything like that. Yeah, Brandon.
CNN was in Dakota City doing a story about the situation there, and obviously you've talked about all the stuff that's been done safety measures wise, but could you speak or comment on just the fact that that area is getting national attention?
The Dakota, asked a comment on the fact that Dakota City is getting national attention. You know, I don't really have any comment to make that Dakota City is getting national attention. Again, we're working very hard there with the facility we supplied logistical support from the National Guard to help them do a lot of testing up there over the last couple of days. And all the other things that Shelley's talked about with regard to our meat processors handbook, all the things we're doing to reach out to the community with regard to non-English speakers and all that sort of thing. So we're working the plan there just like we're working it in Hall County, Dawson County, and any place else that we need to.
Governor, do you want to mention that these facilities were well into precautions and protocols before we started the visiting them?
Oh, and Director Wellman just wants me to remind people that the facilities had started taking steps even before we started reaching out to them to talk to them about what kind of precautions they ought to be taking. So, you know, again, we try to make this a collaborative approach to be able to get best practices established and get all the facilities to be able to adopt those. Okay, I'm not seeing any other questions, so I'm going to go ahead and roll it up here Friday afternoon. Happy May Day, everybody. Again, I want to thank all the Nebraskans who have worked so hard to be able to slow the spread of coronavirus here in our state. Please continue to follow our rules with regard to social distancing. That 6-foot distance rule, of respect the 10-person rule. And especially as you think about Cinco de Mayo parties next week or Memorial Day parties later on in the month, we want you to, best practice, celebrate only with your household, but in any case, no more than 10 people. Please continue to follow those good guidelines, and that will help make sure that we slow the spread here in the state and preserve our healthcare system for those vulnerable folks who will need it. Thank you all very much. Have a great afternoon and a great weekend. Thanks again, Francis. Have a good weekend.
Thank you, Governor, you too.
Thank you, Shelley.
Yes.